synergism. That means 1 plus 1 is greater than 2. It's a teamwork. It's a teamwork. So example is the sulfur and trimethoprim. Sulfur and trimethoprim, then adrenaline and local anesthetics. Adrenaline and local anesthetic. Then sulfur and pyrimethamine. And there are many examples of antimicrobial or antibiotic combination. Now here you can see the sulfur, pyrimethamine, sulfur-doctrine, pyrimethamine, sulfur and trimethoprim, they are having additive effect. This is especially used in the treatment of the malaria. This is used in the treatment of the bacterial infections. So if you give the sulfur alone, the bacteria present may not be responding to that particular patient. But if you combine the sulfur and trimethoprim, the therapeutic output is very great. So here you can say there is a potentiation of the one drug. There is a one drug increase the potency of other. Because of that we are getting the sum larger than the individual effect of individual drug. So these are the combination. Then this adrenaline and local anesthetic. Now let us see this example. Local anesthetic given locally for what? For desensitization. They want to operate on the superficial part of the skin. Small tumor is there or small abscess is there. Then we are not going for the general anesthesia. We are injecting the local anesthetic in this area. So it will get desensitized. We will operate it. Now, if you add the adrenaline, what will happen? It will increase the duration of action. Increase the duration of action of drug. How? Because this adrenaline is constrict the blood vessels. It constricts the blood vessels. So there is a less blood flow. So less blood flow, that means whatever we have injected here, it will stay for longer time and will produce the longer duration of action. Clear? So in this way, if you give this local anesthetic alone, you have to inject at every 10 minutes. But if you give this combination, then 40 minutes. So this is a therapeutic advantage. Why this is happening? Because there is a supra-additive synergism between the adrenaline and local anesthetic. So this, and there are many antibiotic combinations. Say for example, the most common example we are taking is the norflox or norfloxacin and tinidazole. So what is this? Ampicillin and floxacillin, streptomycin and penicillin. There are so many examples. So why we are making these combinations? Because it is providing us supra-additive action. How? Now norflox, it inhibits the bacteria, gram positive, gram negative and all these things. it's a broad spectrum fluoroquinolone antibiotic or antimicrobial which have the wide spectrum of activity against the most of the gram-negative bacteria and gram-positive bacteria. Now diarrhea is not always due to the bacteria, but it may be due to the protozoa, and sometimes there is a mixed infections. So in case of the mixed infection, if you give only norfloxacin, then it will not work, because we are not killing the protozoa. Protozoa is continue to produce the diarrhea. If you give only trinidazole, again it will not produce any therapeutic effect, because diarrhea is not only due to the protozoa, part of the bacteria is also associated. So if you give this combination, then it will work on the diarrhea, because it is effective against the microbes or bacteria as well as protozoa. So you can take many 100 examples like this. Clear? Any doubt? So whenever you are seeing any combinations in the drugs, you have to think. Now you see, in case of the additive, the mechanism of two drugs is always same, almost. In case of the super additive, they act by the different mechanism. That's why they are producing the super additive synergism. But nowadays, in many countries, is banned. Why? Especially in the human, fixed dose combinations of many drugs are under prohibitive order or under restrictive order, or it is banned. Why it is so? Why they have banned? Because people were using this antibiotic combinations or combination of the drug without, you can say, the necessity in the patient. Say for example, paracetamol is available, paracetamol plus diclofenac is also available, paracetamol, diclofenac plus morphine, or you can say some opioid analgesic is also, caffeine is also available. Now in most of the cases, patient needs only plain paracetamol. In very few cases, you can say it requires diclofenac or you can say the codeine or other opioid analgesic. But now what people or you can say physicians are habituated to prescribe this one only. So there is a unnecessary burdens of the cost of the treatment, unnecessary burdens of the chemicals on the body. To inhibit, to prevent this, government has banned this fixed dose combination. Because again it is a market perspective. Science remains underdeveloped, and marketing gimmicks of the pharmaceutical company, manufacturers and all these things, they will do campaign like anything, and they insist or they make the physicians and veterinarians to prescribe the more and more combinations of the drug. તમે એના માયાજાળમાં આપણે આવી સેલ્સમેન આવે એટલે આપણને લિટરેચરમાં બધું બતાવે, they will show us and we will get impressed. Because of that, we'll start prescribing. Now you see, there is also one good thing. Old drug and new drug. Within actions we have studied, that is synergism. Synergism is of two types.